Good morning, everyone. Thank you so much for tuning in to another one of my videos. I'm Dr. Sistare with Palm Beach Cosmetic Surgery. Today, the topic is brow lift. Today I'm going to talk to you a little bit about what is a brow lift, how it's done, the scarring, the recovery, what you can expect on the day of surgery. A brow lift, otherwise known as a forehead lift, is a procedure whose goal it is to smooth the heavy wrinkles on your forehead and to reposition the brows into a more youthful position. There's a few different types of brow lifts, and they differ in where specifically the incision is carried out. To figure out the exact type of brow lift that works for you, it's important that you communicate properly with your surgeon and you have a sit-down conversation with he or she before your procedure. One of the most common types of brow lift is called a temporal brow lift, where you make an incision behind the hairline and your temples right here. And through this incision, we can lift up the lateral aspects of your brow. Another common type of brow lift is called a pretracheal brow lift, where you make an incision right in front of your hairline, and from that you can release the tissues of your forehead and lift up your entire forehead. The advantage of this procedure is not only does it lift up the lateral brow, but it can also lift up the medial brow, lift up the entire brow into a more youthful position. Another type of brow lift is the direct brow lift. If you're a guy and you deal with male pattern baldness, your hairline is receded, so it's very difficult to hide this scar. So another way to hide the scar is to make an incision right through your eyebrow and lift up the brows to a more youthful position, and then the eyebrow hair hides that scar. And then finally, one of the less common types of brow lifts is called a coronal brow lift, where the incision is carried back here behind your hairline, way on the top of your head. The advantage of this is not only can you lift the brow traveling forward through the incision, but you can also advance the hairline traveling backwards onto the back of your scalp. So, like I said, there's a few different positions that we can choose for the incision. It's important to have a discussion with your surgeon about your particular goals. That way you can nail down which procedure is best for you. What is the recovery time like? Normally it's about 1 to 2 weeks for you to completely feel normal again. It takes about 6 to 12 weeks for the scars to fade. During that time, it's important to take precautions to make sure that the scars are as minimally noticeable as possible. You wear sunscreen, you keep them moisturized, you wear hats when you go outside to avoid direct sun exposure. Before your day of surgery, all of this information will be provided to you to make sure that you're taking all of the right precautions to make sure you get the most out of the surgery that you're undergoing. Can you combine a brow lift with other procedures? More often than not, yes. It's combined with at least one other procedure. Normally, if someone is undergoing a brow lift, it's very common for them to combine an upper blepharoplasty, removing the redundant skin on your upper eyelid, because both of these problems, the sagging forehead and the additional skin on your upper eyelid, contribute to the same look, this tired, overlapping brow. It's especially noticeable when your face is sitting relaxed in repose and you bring your eyes up to the ceiling and the first thing you see is either eyelashes or the skin of your eyebrow. So a lot of people come to me saying, I think I need an upper blepharoplasty, but in actuality, what I find they need after examining them is their entire brow has sagged and it's pushing skin down into their upper field of vision rather than just a little bit of extra skin on your upper eyelid. So these procedures work hand in hand to deal with a similar issue. It's often combined with a facelift, which is combined with a neck lift. It's not uncommon for you to combine it with a facial resurfacing procedure like a CO2 laser or a chemical peel to give the face an overall more youthful appearance. There are complications, just like with any surgery. It's possible that you have some numbness following the procedure. This tends to go away in the first few months after surgery. Bleeding tends to be minimal in this procedure. It's not uncommon that you're a little bit tender when you wake up from surgery. This tends to dissipate over the first few days after surgery. So, in a nutshell, that's what a brow lift is. I invite you to come speak with me personally. I can talk all day about this procedure, but unfortunately we're limited to 4 minutes on a video. So, come meet with me. Consultations are free. I'd love to get to know you and talk a little bit about what I can do for you to help you achieve your cosmetics goals. Thank you so much.